Being a pharmacist is weird. I feel like no two people really have the same job, even though that like my friends and we both graduated together. Their experience, their roles, their responsibilities are completely different to what mine are. I think it's crazy that where you choose to work really just shapes who you are as a person and what experiences that you have. And then it also gets me thinking about like climbing the corporate ladder. Climbing the corporate ladder in healthcare, especially in a community pharmacy setting, is completely different than if you were to compare it to like climbing the corporate ladder in finance. In the community pharmacy world, it's really not that hard to get a pharmacist in charge role because a lot of the time it's just based on need and you don't exactly need to have a plan to become a pharmacist in charge. I became a pharmacist in charge after 2 months of working where I work, simply because the pharmacist in charge left and I had to like step up super quickly and take on the role and responsibilities of a pharmacist in charge. Because there was no one else to do it, I just had to step into it. But that's just the great thing about being a pharmacist in community pharmacy. You get exposed to a lot of things, a lot of the business side of things quite quickly, quite early on. And if you have a good owner or a good sort of mentor, then it's really easy and quick to learn about the business. But I think the thing I struggle most with when it comes to being a pharmacist is the fact that yes, we have to keep the business in mind, but we also have to think about the patient and patient affordability and choosing the right product for the patient's health and needs, whilst also trying to recommend things and hit certain budget targets and things like that. I don't know, sometimes I honestly feel like a real estate agent where we as pharmacists don't own any of the products. Like, we work at a pharmacy, we don't own the products, yet we have to like sell the products that we have in store to our customers. But we also have to keep in mind the patient's safety and if it is even appropriate for the patient to take. The only difference between like us pharmacists and a real estate agent is we don't work on commission. How nice would it be to actually get commission on a sale that we make from a product? Let me know if anyone else sort of has these thoughts or if it's literally just me.